Hello, my name is Vikesh Patel. I'm a practicing community pharmacist in Newham and work for the local pharmaceutical committee. For a community pharmacist to have access to eLPR supports with the daily work of making safe supply provisions of medicines. The crux would be saving time and giving me access to a richer data set compared to the summary care records at the click of a button. So in my practice as well, I would feel that summary care record is a contingency or as a backup. If something was to happen to the shared care record and their servers go down, then we'd still have access to summary care record. The difference between the two is summary care record has a lag time where the updates are not in real time, whereas with eLPR, the updates are pretty much as soon as someone puts a record up and the viewer can pull down the most latest and up-to-date information. With the summary care records, you only get to see the repeat medications and acute medications of the patients, no notes, whereas with the shared care records, you can see the GP's notes. So where the message is of how long a treatment needs to carry on, or when it needs to be stopped, or if there is a change that needs to be taking place, the pharmacist can read that at our end, rather than just summary care telling us these medicines are repeat and these medicines are acute, and that's it. So there's no substance to the prescribing ongoing. I had a patient call on a Saturday asking for her medication to be delivered, and this is her anti-epileptic medication that she uses to prevent her having any seizures or fits. So we've got an epileptic patient who's on a range of anti-epileptic medicines. She is not clear on what is her current dose that she is to take for maintaining the stable condition state. Hence, she contacts us for a supply of a medication. I've got two sets of prescription, and therefore there's confusion on the clarity of which one is valid for the current time. Considering we are on a Saturday, there is very difficult access to get to a clinician or a prescriber at the patient's general practice. I have to rely on a record to be able to see the narrative, which then allows me with the information to make a clear decision as to which medication I have to supply. And that's when eLPR comes in. I don't go down the SCR route because SCR just tells me very little about what has been prescribed to her, and I already know what is prescribed because I'm holding both the prescriptions, whereas the eLPR tells me which prescription was issued when and what the GP's notes are on in terms of the most current treatment plan. And I use eLPR to come to the decision of making the safe supply to maintain the patient's stable state within the community. For my colleagues, eLPR provides you a tool at the time of need where clarity is required in making a safe supply to your patient. My advice to fellow colleagues would be to utilize the tool at their disposal to allow them to improve the provision of care that they provide to their patients and their communities.